Good morning, and thank you for joining us this week on Thursdays with AARP Wisconsin. I'm Amber Miller. I am the Associate State Director of Community Outreach, and I'm really excited to have our speaker today. Before we do that, let me just make a couple announcements. If you're interested in taking any of our virtual offerings that are coming up this month, like Movies for Grown-Ups, we also have an event on June 23rd, which you're going to learn more about how to use the trails safely during COVID-19. You would visit our website below, which is aarp.org/Wisconsin. We'll give you all the updated information on all of our virtual offerings. I would also like to announce our Community Connections website. This is where you can find additional information on health and wellness, also cooking information, and also AARP Friendly Voice. This is an initiative that started a few months back that you can request a call from one of our trained volunteers to give you a call, a friendly voice, see how things are going. And that is free. You do not need to be a member of AARP, and it is actually open to people of all ages. So next, I'm very excited about introducing our next guest speaker for Thursdays with AARP Wisconsin. I've had the pleasure of working with her for almost a year. And so I would like to say good morning to Helen Marks Dicks. Good morning, Helen. How are you?
I'm fine, and good morning to you, Amber.
Good morning. I also want to point out that this recording is pre-recorded. This is not live, but if you do have questions for Helen during this video, you could still put them below in the comment sections and we will ensure to get back to them. So Helen is our Associate State Director of Advocacy with an emphasis on some of our state issues. And so we wanted to dedicate this time to Helen to talk about all the great things that she is doing with advocacy around nursing homes, caregiving. It's a really busy time right now, especially with everything that's happening. So Helen, maybe just to start off, if you could tell us, not everybody's familiar with what advocacy is and how it can impact, make such a big impact in the community. Can you talk a little bit about what does the word advocacy mean?
Well, advocacy is really just basically speaking up on your own behalf or on the behalf of other people to change the system or to change a particular set of circumstances. So it's really your opportunity to talk to your government, to talk to your consumer protection people, to talk to your telephone company about your bill. It's just speaking up to change things, hopefully for the better.
And Helen, how long have you been with AARP?
I've been with AARP for 9 years, but I've had a lifetime of advocacy. I'm one of those people who likes to tidy up the world and make it run better. And so advocacy is a natural thing for me.
Absolutely. So AARP has been a long champion of caregivers and really strong advocates for like quality care in nursing home, and especially during the COVID. But during the pandemic, the death rate in the nursing homes has been very high, and some families have been not able to visit their loved ones. So how has AARP responded to this crisis?
Well, we've kind of taken a two-pronged approach. One is to help families that have people in nursing homes, giving them ideas of what questions to ask the nursing homes, and I'm going to talk about that more later, and giving them an opportunity to know what's going on. The other part of our advocacy has been more advocating with the government. We wanted to make sure there was public transparency, that people know which nursing homes had COVID cases. We wanted them published. We wanted the deaths in nursing homes published, because it's very hard at the beginning of this. They were being extremely secretive, and that is so stressful for the families not to know if your loved one is in a home that has the disease. So a public-facing and a member-facing campaign going on at the same time.
Absolutely. And I know you have been a resource to me, as my 93-year-old grandmother is in a nursing home and not knowing what's going on. So I definitely can say that Helen has been a really big advocate when it comes to nursing homes and caregiving. So thank you also for helping me. So what advice would you give family members on how to deal with the nursing homes, whether they have concerns, questions, not getting their questions answered, what advice would you give?
Well, AARP came out with 6 questions to ask a nursing home. And I mean nursing home broadly. I mean at any place where they're providing services to an older person, where they're living there and they don't have an opportunity, and you don't have an opportunity to visit them. So we came up with 6 basic questions, and I'll go through them. The first one is just plain asking the simple question: does anyone in the nursing home, either a patient, a resident, or a staff member, tested positive for COVID-19? That's your basic starting place. Is the disease in the facility? The second question is, what is the nursing home doing to prevent the infection? I mean, infectious control is a big deal. And when you have a lot of people living close together, there are policies and procedures that you can put in place to control. So you should ask the nursing home specifically what they're doing in that area. Then the next question, of course, is to ask if the staff has the personal protective equipment that they need, because that's the way the disease is most likely to come into an institution, is through a staff member who has contact with people outside. And so, do they have the protective equipment? Are they using it? Is it available to their staff? Then the next question, of course, is the social isolation question. It's really hard for an older person who's in a facility not to have visitors. So what is the facility doing to keep the patient, the resident, connected with their families and others? Are they providing telephone appointments? Do they have a video service? Do they have iPads? What are they doing to connect? If there's no visitation, how do you keep people connected to each other? And then the next question, of course, is, it's one thing for the loved one and you to be in touch, but it's also important for the nursing home to be in touch with you, to tell you what's going on in that particular environment. So what are the policies and procedures that the nursing home is doing to communicate important information to you? And not just COVID information. I mean, you can fall out of bed and break an arm. What's happening in that resident's life? What changes are going on? You really need to know that kind of thing. And finally, we encourage you to ask about the nursing home staffing levels. Because in a lot of places we're hearing that people just don't have adequate staff. In a lot of places, families and loved ones have gone in to provide feeding and support. And so it's very, very important that you ask what the staffing level is.
I can say the 6 questions that you just shared with us, I think is beneficial for anybody who's feeling like they're not being heard, either to get information on their loved one or being able to talk to their loved one. If people would like to follow up on those 6 questions, where can they find that information, Helen?
Well, information is in 2 places. It's on the National AARP website. You just go in the search box. If you write 6 questions, it comes up in a nice little chart for you. Right. Or it's also on the AARP Wisconsin website.
Terrific. So you also said that AARP Wisconsin advocated to have the names of the nursing homes with active cases report public, as well as also having the death counts public. Why was that transparency important to AARP?
Well, it was important for a couple of reasons. One reason was it was so stressful to our members who are caregivers to be isolated and cut off from any contact with the people in their homes, and to sit there and worry whether the nursing home is being honest with them, whether they have to rely on the rumor mill. You know, how are they going to know that they were doing what they should be doing regarding their person that was in a facility? The other reason it was really important is this is a disease that hit older people exceptionally hard. And by ignoring the nursing home deaths, it was underreporting both the seriousness of the disease and the impact on older people. And of course, being AARP, we kind of keep an eye out for us older people. And so it was really important that people could know. I always think anything done in secret is a bad thing. Correct. And so AARP all over the country has worked very hard on that transparency issue. We now in Wisconsin succeeded. I would say we succeeded halfway. We are now have a website where you can go, and I understand you're going to put it up because I read those things and nobody hears it because I talk too fast. So you can go to this website and find out what nursing homes have active cases. It's very reassuring to know what you're dealing with and not just worry about something that's not there. I say we were halfway successful because this website is only updated once a week. And so I, of course, would love it updated daily, but it's a big step in the right direction of finding out what's going on. And not only has the state of Wisconsin now required that they report all COVID cases and COVID deaths to the state, they also now have to report them to Medicare. So that helps.
Great. So today I am talking with Helen Marks Dicks, our state advocacy director, all about state level advocacy. And she's talking today about nursing homes and ensuring that our loved ones are taken care of, ensuring that we're getting information. So please make sure you share this to your Facebook page, just in case anybody you know would be interested in this information that Helen is sharing today. So Helen, I am going through this currently. As I stated, I have a 93-year-old grandma who's in a nursing home who unfortunately has dementia, and with everything that's going on, it's really hard to stay in, to connect with her. So what advice can you give to me so I can stay in touch with my loved ones in a nursing home if I cannot visit in person?
Well, there are bunches of ways. I mean, you can ask a nursing home to set up, well, it depends on, I should step back a minute. It depends on the level of functionality of the person that you're trying to stay in touch with. You know, if they can do telephone calls, if they can communicate like that, you know, maybe the thing is to, if they don't have a cell phone, make sure they get one and, you know, call them. Sometimes the nursing homes are able to set up video visiting, which is really kind of nice. Sometimes they want you to have an appointment so that they can have the person at the right place at the right time to do that. I am a firm believer in the postal system. Sending people notes and cards makes them feel connected to the outside world. You know, particularly people who have young people in their lives, get the kids to send drawings and, you know, little reports. And I think it's very important that they just have some kind of contact like that.
Correct.
Now, your grandma's lucky because she has you. I would like to say a word on what we call the unbefriended elderly, which are people who, for whatever circumstances in life, have ended up at this point in life without having family or without having a support system and aren't getting any kind of outside contact. I just urge anybody that this is a good time to start a pen pal program. I remember being in high school and, you know, getting a pen pal in a foreign country and being all excited about it. I think you can write to you can do a couple of things. You can contact the social worker at a nursing home and say, does anybody need mail, and just, you know, pick that person. Or you can write a bunch of cards introducing yourself, put them in an envelope, mail the whole envelope to the nursing home with a note saying, would you distribute these to somebody who doesn't have visitors, who isn't receiving phone calls? And in that little note, introduce yourself and say, like that person in the home, you're kind of isolated at home, you're not going out, you're willing to be a pen pal. Is she interested in me, or he interested in being a pen pal? And then a little about yourself. It doesn't have to be terribly personal, but it does have to be friendly.
And I love that idea, Helen. I love that idea. I think the isolation is horrible as it is, but especially like the last few months with COVID and people having to do safer at home and their life changing. Imagine just getting a piece of mail or flowers or anything dropped off, how much that would brighten somebody's day. So I love that idea.
Yeah, and it's the silly little things that brighten up people's day. So, you know, that's a good thing. You know, there's been a lot of work with people who have dementias too, that they remember music. And so that if you do call a person that really doesn't have the opportunity to maybe converse with you, if you play the music from when they were young, they're very, very responsive to it. So, I mean, it's just an idea to keep in the back of your mind to make things a little friendlier.
Absolutely. So there's still a lot of things that folks can do, even if you can't physically visit your family member. It sounds like a lot of really great ideas that will brighten somebody's day. And I also love the fact it's almost kind of like you can adopt a grandparent. So, reaching out, as you said, to the social worker and just saying, is there anybody there that would like to converse or write letters or be a pen pal? It's a really great way to help somebody during these tough times with isolation. And also you can find a new friend. I always learn something from, somebody new every day. So I really love that idea. I might do that today after the phone call.
And remember that those of us that are not sweet little old ladies, us grouches need friends too. So some of us crabby old ladies who tend to be a little opinionated, send us a card anyhow. Right back, even if they're kind of grouchy.
I do have to say, Helen is not grouchy. The one thing I will say about you, Helen, is your passion to better our community, better our state. I always have admired that about you because it really does take the passion and the fire to keep all of this moving. And I think, just talking about the things that AARP has done, it takes a village to raise a village. And definitely you are the leader of one of those villages by, let's get moving. I would like to share a couple pictures of some of the impact. And Helen, I'll have you maybe tell a couple stories of like who these folks are and why they're so important to AARP.
These are my favorite people in the universe. They're called Red Shirts. They're AARP advocacy volunteers. And what they do is they do lots of things. But among other things they do is they show up at hearings. They wear their red shirts so people know there are a lot of us and that we speak not only for ourselves, but for a lot of members. Some of the members red shirts will actually testify at hearings. The legislature needs to hear stories about how what they're planning to do impacts somebody's everyday life. They need to put a face on a problem so that they can solve it. So these are the people these pictures are them showing up. This is a joint finance committee meeting, but they also show up by email and by phone and any way we can contact legislators to express our views. This picture was taken at one of our trainings. We don't take our advocates and just throw them to the wolves and say, go tell your elected official A, B, and C. We give them training on the background of the pieces of legislation, why we think it's important, why we pick particular things. And we give them a basic training on how the system works. So you know where in the system to put the pressure on so that you make sure that you have an impact. I have to say, I find our volunteers very inspirational because they come from all kinds of backgrounds. We have nurses and professors and union stewards and people who have worked retail stores, people who have been caregivers, nurses, completely different backgrounds, lots of diversity in their opinions about life. But of course, what binds us all together are the common issues like caregiving, Medicare, Social Security, and just general concern for older people. Many of our volunteers are significantly older than I am, which is kind of, if they can stay this active, so can I.
I do have to say that AARP Wisconsin volunteers are amazing. So the pictures that you showed were, of course, more volunteer opportunities and training in person. You kind of alluded to the fact that there still might be some volunteer opportunities for advocacy, maybe virtually. If you could talk a little bit about that, and maybe if somebody is interested, what would be the next steps?
Well, I think that we're going to go into a legislative session and even into the next year where big gatherings are going to be different. I don't even know how the legislature is going to meet. Our tradition of showing up at joint finance meetings and filling up 2 or 3 rows with red shirts, I'm not sure that's going to work. So what we need to do is to get more volunteers that are willing to be volunteers from home and who are willing to do things like make phone calls or send emails to their elected officials. Lisa and I, our other advocacy person, are talking about how we're going to do trainings, because I think we may go well into next year where we're still at the point where we're doing written comments to legislators, letters to the editor campaign, emails, things like that, where we have to virtually do things. The other thing is I'm trying to, we have that nice look of solidarity with all the red shirts behind the person that testifies. I'm trying to figure out how to do that on Zoom. I'm trying to figure out
knowing you, Helen,
you
you will figure that out. So I'm not even worried. But it's interesting when I first started AARP, how when our volunteers and our staff all wear those red shirts and we're, walking in, how impactful that is, of like AARP is here, we're passionate, we want to support. So I think those two pictures that you shared today really tells the story of what AARP does within the community. But our volunteers really, we need the volunteers. They're the ones that really help us move agendas forward.
I think about the red shirts, it's kind of like a chorus. If you want to be in the chorus and not take a leading role, that's fine. If you want to be a soloist and testify, that's fine. If you want to be a coordinator and help coordinate red shirts and do that kind of thing, any talent that you bring and any willing involvement level is very, very important. And we're willing to train you. And the nice thing is, let's say you agree with me on everything except one issue. And I send out an email and say, I need people to send emails to the legislature about, and I do it. You can say, nope, this is not my issue. Now we ask as a volunteer, you don't speak against our issues, but you can pick and choose how much time, which issues you put the most energy in. So it's a wonderful opportunity to make a difference in your community and help your other silver-haired adults live in a better world.
And so what's really nice is, this video is all about advocacy and what AARP is doing for nursing home and caregivers, but it also is just a great opportunity to put it out there that we are still looking for advocacy volunteers who are passionate, who have the same drive as Helen, and there's still things that you could do from home. So just because it is, safer at home right now, it's still an election year. There's still a lot of topics and issues that AARP is passionate about. So if people are looking for more information, Helen, on volunteering, would you just point them to our AARP Wisconsin website then? Would that be the best way?
That would be the best way.
Okay.
And let us know that you're interested. We are more than willing to train volunteers. And this is going to be an interesting year because it is an election year, and there's tons of issues beside the election. Like we talked about nursing homes.
Correct.
They're beginning to do the process of talking about if then when they open them up, what the rules have to be. What changes have to be done because of how infectious everything turned out to be. And there are other issues. All the people that needed unemployment compensation help because the checks didn't come through, all kinds of education. I mean, I could come on every day of the week and talk about something and drive you crazy, but there really is a whole array of issues. And one of the things I would say, since people are going to see this and they're going to send you all kinds of questions on chat, is if you have advocacy issues you'd like me to talk about, I could get Amber to invite me back if you give me topics. Do you want to know how a bill becomes a law? Do you want to know what's specifically going on in caregiving? Do you want to specifically know AARP's areas of interest tend to be financial resilience and healthcare issues, and consumer protection issues and voting. So those are 4 huge buckets. So if you're interested in something in those buckets, I would let Amber know, and she could probably, among the staff, find one of us willing to talk a little opinionated, and hopefully entertaining enough to listen to.
Absolutely. And that's the one thing about Thursdays with AARP Wisconsin is we want to bring you information, resources, and topics that hopefully are of interest to you. But if you would love to hear more from Helen or more on certain advocacy topics, please leave a message below, or you could private message us through Facebook. So Helen, we're going to be coming up on almost the 30-minute mark shortly. So do you have any last comments, final comments, words of inspiration for our listeners today?
Well, I'm going to leave you with a bit of a tease. When I was doing my research to make sure I had the 6 questions right, I came across a document called 7 Questions to Think About if you're thinking of taking your person out of a nursing home because it's safer. And they were really good questions because people in nursing homes really need a high level of care. The impulse to just swoop somebody out of the situation is not always appropriate. But it brings me to the fact that if you go to the AARP websites, there's tons of information on caregiving and lots of aids to help you work through some of these decisions that are very personal, but still very systematic in how you should make and weigh things.
Absolutely. I do encourage all of our viewers today to not only go to the AARP Wisconsin page, but also go to the AARP.org national page. That website alone has so much good information that I definitely encourage you to browse through it. You might find some information that you didn't even know you were looking for. So that is our national website. And Helen, I want to thank you so much for joining us today. I miss you at the office. I know one day we'll be together soon, but I do have to say thank you so much for all that you do for our 50 plus and everything that you do for the state of Wisconsin and AARP. So it was really great to have you. And next week, I will be chatting with Neil, who is our state coordinator for AARP driver safety, and he's going to talk a little bit about the AARP driver safety program that you can actually also do virtually. So join us live next Thursday at 11 a.m. Central Time to chat with Neil. And thank you again, Helen. We really appreciate it. And thank you, everybody, for joining us today. We look forward to seeing you next Thursday. Take care.
Thank you.